We'll quickly try to look at the next drug here, which we'll be talking about. It's pharmacology, and this is what is known as Capromab pendetide. Capromab pendetide. Yeah. So this is Capromab. Okay. Capromab pendetide. So it's a radioactive drug. It's labeled with an radioactive substance. So you should know that it's a murine monoclonal antibody. It's conjugated to the chelator pendetide. So this is labeled with what? Indium 111. So they usually use it for what? Diagnosing things. So that I can be able to image in a better way rather than treat. Okay. So it goes by a trade name known as ProstaScint. This one. ProstaScint. Alright. So it's a prostate specific membrane antigen that it targets this antigen, right? So this antigen is usually expressed when there's prostate cancer. Okay, so if you give this drug, it will bind to it. So when this drug binds to it, it has a radioactive substance known as indium 111. So these things will kind of like be shooting out signals. These signals, you can now be able to capture them on your gamma camera and be able to do an image in there. So it's used to dictate if there's prostate cancer. I can image inside your prostate and be able to see the location of the cancer. This will guide me on which treatments to do, either radiotherapy, chemotherapy, or I should do some watchful waiting and all of that. So pharmacokinetics, I give it through the veins, and it will only bind to this prostate what specific membrane antigens. Metabolism is proteolytic, and half-life is sufficient image, and that's when you give it, you can now be able to image from 3 days to about 5 days after I give it. So clinical uses, you use it mainly for imaging for prostate cancer. Okay. So these are some of the images you can get. Um, well, here they say that I can also image the liver. See, anything that is for imaging, right? You can always probably try to. Okay, this one it could be that the prostate cancer has spread to other places. Yes, that's the best explanation for this. You had a prostate cancer, it spread. I know that cancer usually spread to the lungs very fast, and that's what usually even kills patients. So if it spread to the lungs, it's still having the prostate specific membrane antigen. You can still be able to use this to track it.